In this video, we're going to treatment plan this patient who presents with occlusal muscle issues, primarily related to sore muscles, sore facial muscles, temporalis, masseter, and I'm sure the lateral pterygoid as well, are all playing a role in this. But she wakes up with sore muscles in the face. She notices clenching during the day, and she's really unaware that she's got occlusal disease, but she just knows that her muscles are sore and tired. Although her chief complaint was just that she wants this big bridge that broke off. She wants it replaced with a couple of implants. So we're going to start by looking at her from a centric relation point of view. These records were taken in centric relation, and I will evaluate, can I do anything with the occlusion to help her overall condition of occlusal function in the process of restoring her with a couple of implants down here to replace this failed lower left bridge. This entire treatment planning process took about an hour and 10 minutes, which is fairly typical for treatment planning a complex case, but it allows you to do complex dentistry in an organized fashion and is well worth the time invested. I'm going to run this video in real time so you can see exactly how the process works. So we'll get into ExoCAD and show you how this goes. So this lady came in because she had a big bridge here. Goes from, I guess that's 18 to 21. And it broke. The back tooth has got decay and quite a bit of decay. Could probably be restored with a root canal and a build-up and a crown. But she really wants implants here. She doesn't want a new bridge to go back in. And the bridge too long of a span anyway in today's world with implants and whatnot. And so we did a comprehensive exam. We took these models, and part of the comprehensive workup, we always start with the TMJ. And in her TMJ exam and workup, she revealed that she has quite a bit of muscle soreness, primarily the masseter and the temporalis is where she notices it. Wakes up in the morning with sore jaws, tired jaws. Enough that she brought it out in the exam. As we were palpating, the masseters are tender, and the temporalis was tender as well. So we start to go through our TMJ exam, and we're looking at centric relation. And in centric relation, she felt like she hit first on this right premolar. But when we marked it, we found the first point of contact to be back here on the second molar. And because we're manipulating her into CR, and then with paper in between the teeth, we just bring her into light contact and tap at the moment of CR. Now, quite frankly, her muscles are relaxed enough that she hinges very freely, and we were able to reproduce centric relation quite comfortably. So we captured these models using a leaf gauge between the front teeth, and we keep removing leaves until the patient feels the point of first contact, and then we remove one, put one back in until we establish exactly where that first point of contact is, and then at the lightest point of contact with the minimum number of leaves in that gives us just very, very light contact, we capture this bite registration. Now, why is it that we capture the first point of contact back here and she feels it in the premolar area? Maybe this tooth is mobile. I'm going to go back now at my re-exam and look at this and see if this tooth has some mobility and exactly why she's feeling something different than what we're capturing. But nonetheless, this becomes a good exercise in figuring out what I can do with this occlusion. Now, obviously, we want to put a crown here on this tooth and a couple of implants back here. So I'm beginning to think, what do we need to do with the occlusion, though, to try to stabilize her? And can I equilibrate her so that centric relation and centric occlusion are the same? So this bite is taken in centric relation with the jaws fully seated, the condyles fully seated up in the fossa, and when we hinge her in, of course she hits prematurely and then slides in until the front teeth touch, or at least come closer. So you can see that things are not ideal. Her maxillary incisors are reclined lingually, and so obviously it's not going to be a perfectly ideal occlusion, but we see what we can do. Now, I've already done this equilibration, and in the process I determined that if you notice these cuspids here, these are crowns. Those are not natural contours. Those are crown teeth, and they've been restored with no cingulum. They have absolutely no cingulum whatsoever. Very common. We see this all the time, that the cingulum gets ignored, or for whatever reason they're doing everything in CO and they just make these flat contours. I figured out that if I just add a cingulum, I am actually able to get these cuspids to come into contact. So what I did initially is I began equilibrating these models. When I saw I couldn't get the cuspid to touch, I started thinking, well, can I do anything additively to get this to come into contact? And sure enough, yeah, I was able to do that. And so I'm going to do this second wax up now and equilibration with the idea in mind that I know I'm gonna simulate the crowning of these two cuspids in order to establish a better occlusion for this lady. Now, this lady's like 80 years old or 75 years old, something in that nature, and so she's been doing okay for a long period of time, and so I don't necessarily have to make her perfect. But if I can make her better, I think that's what we ought to do, especially in light of the fact that she's got these TMJ symptoms of muscle tenderness and discomfort. Now, also mind you, I can load test this jaw as I hinge her in centric relation, and I apply pressure through the angles of the mandible up into the condylar area. She has no pain, tension, or tenderness in the condylar area as I'm applying that pressure. So that tells me the medial poles are intact and that I can proceed with restorative treatment, or I feel comfortable with that anyway. So here we go. I'm going to first put this thing onto the articulator. So we'll start the virtual articulator, and I'm just going to go through this kind of quickly. I don't modify the scan data. I'm just going to let it open the articulator, re-articulate the models virtually. This is going to put them on an average hinge axis of 100 millimeters from the condyle to the incisor. I don't want to do that. I want to open the articulator. So here we have, that's the way the models are articulated in centric relation. I've got all these parameters set, and if I turn the articulator on, you'll see that I've got the pin of the articulator up off of the bed. I don't want the bed to influence any of the movements. I want just to see what the teeth are doing as they move. So Let's move the lower jaw and let's start motion. Okay? So now the ExoCAD has memorized the motions. I don't need to visualize the articulator anymore. So when I accept this, I'm going to keep the raised bite, and the articulator kind of goes away because I can go through the motions and I can see what's happening, and can see as she goes forward in protrusion, she pretty much never hits those cuspids, but you'll see as we go through this, we can make that happen. Lateral, lateral. Here she's guiding on the opposite side, and I will go back and double check this in the mouth now that I see what's going on, because that's an extremely traumatic occlusion. That would certainly cause sore muscles, clenching, and she describes clenching and grinding. She knows she does all this type of stuff. And then as we move the other side, as she comes this way, it's she's guiding pretty much on the premolar here. If I turn the colors on, turn dynamic off, you can see this is where she's guiding as she comes out the right side. At least as she goes far enough out to get away from those premature contacts. So what are we going to do? Let's do a little bit of equilibration, and then we're going to add to those cuspids to simulate that and see what we can do to improve her occlusion. That's on an incline, so I'm pretty much going to kind of remove most of that. And now we have to rerun the articulator movement. I like to switch to the opposing jaw. See if maybe I can do a little bit of split between the two arches. Okay, rerun. And you can see we're starting to pick up more dots through more teeth. Pretty much eliminate inclines. If it's on a good flat Surface, I'll leave a remnant. Every time you rerun it, you see you're going to pick up more spots. I tend to alternate between the arches just to not excessively remove. I don't like to remove out of fosses, but I want to try to hit the inclines. So that's that long area that's making the mark down in the lower fossa. Okay. Okay, we're starting to get marks on all of these teeth. Now, of course, we will not get any marks over here because there is nothing to occlude. So my goal for this adjustment, equilibration, is to get even contact as I can on these and then build up the cuspids in order to give me my centric contacts on the cuspid teeth. And you'll see that that actually works out pretty nicely. So let's continue. I'm going to leave the remnant of that dot down in the fossa there. I'll leave a remnant here. I'm leaving a remnant up on the cusp tip. Get rid of all the inclines. I'll leave a remnant there on the mesial marginal ridge. Get rid of the inclines. And I'm going to get rid of that. Okay, so now hit OK and rerun the movement. Every time you rerun the movement, it's just like when you equilibrate on stone models and you have to put paper back in there and tap it in again. Okay, so let's look at the lower arch real quick and see. Working on the inclines. Remove the inclines, leave a remnant on the flat or the cuss tips. Okay, let's rerun. Okay, so we're starting to get better contact. Let's work it just a little bit more. Now in ExoCAD, the light blue is the 0 point. That's where things are just contacting. Blue actually indicates slight clearance, and these green, yellows, and reds are interference. So you'll see now I'm really trying to leave my cyan color, the light blue, alone and basically work on getting any possible incline out of function. Okay, so hit OK, and now rerun the movement, and we'll see if if it brings up any more here. I'm going to say no. I'm going to say that that's pretty much stable, so nothing else came up that I need to deal with. Nothing's on an incline here. These are all on cuss tips or flat surfaces. You might could say that is just a little bit. Rerun one more time. See if any of that comes back. Not really. Okay, so I've got this equilibrated pretty evenly all the way through there. Let's look at our cuspid. Looks like it's separated pretty far, but I was pretty amazed when I did the modification at how it turns out. So we're going to continue modifying this molar, and now this time I'm just going to add a cingulum until I get contact. Let's add a cingulum over here till I get contact. So now we're got cuspid contact. Might need to soften this one just a little bit. Because if I have too heavy a contact on the cuspids, then these contacts will go away. But let me hit OK on that and now rerun the movement again. Okay, so there you go. We have even contact. We're not getting, let's turn dynamic on. Now, when I turn on dynamic, what that's showing me is the sum total of, let's just go through the motions here. So as I move to the patient's right, okay, I can see that I am still rubbing back here. So I'm just going to leave it right there at that position, and let's adjust that. That cusp is too long out through there. So now as I rub, okay, as I go a little further, I'm starting to guide here in this premolar. So I would want to adjust that too. Just gonna take the angle off of that. Actually, before I do that, I just undid all those changes. Before I do that, let me go ahead and build up my guidance on my cuspid. So if I come right here and I add right through this area, now I'm definitely a little light right there, so let me add some to that. And as I go through this movement, if I make sure that my cuspid is hitting harder than it is back here, got a little too much right there. I don't want to make it any steeper than it has to be. Now when I rerun this, you'll see that these lateral interferences more than likely go away. So as I move in that direction, I'm guiding on the cuspid the entire way. I still have a little bit back here, so I'm going to get rid of it. So like right here, I want to get rid of that one. And as I come further out, I pick up that premolar. So I'm going to get rid of these. A little more. So when I get back into centric, I see my contact points on the posterior teeth again. But as I move, I'm getting rid of all of those posteriors. Let me see if I can adjust that. Yeah, that's not my centric, so let's take this out. And that's pretty good. Okay, let's look at the patient's left lateral movement. In left lateral movement, you can see it's guiding over here on this opposite molar, like we did. But, well, let's build up our guidance on this front tooth. So let's just add wax here and see what we get. Well, that's going to be too steep as we go. So let me take a little bit of that out. Let's just make it heavy on this cuspid. See where my opposing is at that point. So I'm just building up that lateral guidance so that at least the cuspid is touching. And then now, well, I don't think I can quite do that, so I'm going to smooth that out a little bit. To where that cuspid looks somewhat normal. And then I'm going to adjust back here. Okay, let's rerun the parameters and you'll see it'll change quite dramatically. Okay, so I've done too much because my only contact is now over here. So let me remove some of that. Let's rerun it. Starting to pick up my centrics again, but I still need to flatten that out some more. And rerun it. I got to get back to my centrics. There we have. Back to my centric contacts. Now let's see what's happening in this left motion now. As I move to the left, I still got a little bit of rub over here. So I start sliding left, and I got a little bit of rub. Not bad though. I can play with it a couple of ways. I can add just a little bit right there. Rerun the movements. Now let's see what happens. Now as I guide out, I'm picking up a little bit right there, but it's not much. Remember, it's only the light blue that's contact blue is actually a separation, so it's guiding right here, very definitely. And I would probably choose not to steepen the guidance any further, so I'll just remove a little bit back here. Okay. And now I'm pretty much guiding on my front, on my cuspid in that lateral movement. If I look at protrusion, there's all my centric contact points. And as I come forward, I'm on the cuspid and the incisors. And right lateral, guiding on the cuspid only. And in left lateral, guiding on the cuspid only. So I feel very comfortable in recommending a couple crowns for these front two teeth, because now I would have from centric relation, which is right here, she's got contacts on her cuspids, and when she moves forward, right, and left, she's not rubbing on back teeth. Now all I have to do is set teeth over here in the for these three teeth, and I've got my wax up completed. So I've actually got this set up to do a temporary crown on this premolar, and that detected that margin fairly accurately. I'll go ahead and pre-print a temporary and have this, ready to go when we see her again, and I can cement this in place. So that's getting that ready for a temporary. And now we can add a couple of wax up teeth to the back. So let's position this temporary crown a little better, obviously. Doesn't have to be perfect at this stage. We'll perfect the occlusion in a minute. Get it to the approximate size that we want it. And now let's add a couple of teeth. Get it into chain mode. Lock that premolar in. Now I can position these teeth. Cusp fossa relationship type scenario. That's not bad, not bad. Tap the occlusion and probably have my wax up done. So now, what is my treatment plan? Well, my treatment plan is an occlusal equilibration, crowning the two upper cuspids, two implants down here with crowns that'll be splinted, and a single crown here at tooth number 21. We're going to just take this tooth out. It's badly damaged. Rather than doing it, she doesn't want to do a root canal and fix it. She'd rather have this right here. And I think that's all that she really needs. Although you certainly could do a root canal and probably restore this tooth. It's a little bit of heroics, but not excessively. So we can certainly work with that. So now these can be exported. These files can be exported. I can export this, bring it into Blue Sky, and in Blue Sky I can plan the implants, know exactly where I want my teeth to be, so I'm going to put an implant under each one. I've already kind of preliminary looked at her CT scan, and I see that I got quite a bit of bone back here to work with, so I think we're going to be fine. And so this becomes my plan for my prosthetic plan for determining where to put the implants and creating the surgical guide. And we'll do that in another video. Okay, so now we open the original planning in Blue Sky, and you can see I've already got these two implants roughly planned out. I've marked the nerve. I can see where all that is. So let's double check these implants. Now, I do most all of my final planning over here in the tangential window. So if I'm looking at this number 20 site, let me label these 20 and 19. So if I look at this number 20 site, okay, I've got a large abutment on here to simulate, I believe, an 8 millimeter premolar, which may or may not be in the correct position. When we bring our wax up in, we'll be able to refine that. And it's a 4609. And then at the second molar site, notice the angles. It's not following the bone. It's following more where I think the teeth ought to be, but our wax up will help confirm that. Here again, this is just preliminary planning. I did it literally with the patient to show her how we plan implants and the fact that I thought that she had enough bone in order to do implants. I think you're probably going to find out this is going to wind up rotating more in here, and we may even change the implant out, but suffice it as to say, here we go with doing our preliminary planning, and we can now refine it by using our wax up. So there's enough bone for a couple of implants, there's no question. Let's bring our wax up in. So I'm going to flip back over to ExoCAD, and I'm going to export this model. Export scene to mesh. This will cause everything on the screen to become a single STL file. And let's just save this as wax up. Save visible objects only, yes. And I'm going to use the coordinates that let me see. I don't think it really matters. I'll keep everything in the coordinates that we've got them on the screen here. And so now back in Blue Sky, I can bring in that mesh. me take the original and turn on the visibility. Get rid of some of the scatter. And now I will isolate this model. That's going to get rid of the maxillary arch. Now when I do my alignment, model manipulation, yellow model, align using points. This should come up a lot faster. Here we go. Just setting this up for the recording. So now, if I can find a few clean spots here that I can align to, like maybe that spot there. It's relatively similar. You always have a lot of scatter, so that's a pretty clean spot on that cuspid. I can always find the spot on the right hand side of the screen. It's finding good points over here that's kind of critical. So I kind of like this area of the cuspid here. So let's mark it on both sides. And then back here, sort of right where that groove, just to the buckle of that groove, looks pretty clean. So I'll mark just buckles of that groove over here. That's 4 points spread pretty much around the arch. Let's tell it that those are the same and let it do an alignment for us. Okay. I would expect there would be a slight difference. Now, we just need to figure out which one we like best. So if I go all the way over here to this side and check it, so far I like the yellow one best. Now they start to run pretty close together. Okay, pretty good. It's a judgment call, but I think I kind of like the yellow one better overall. So that's the one that I'll go with. Just going to turn the visibility of that one off. And now let's bring in our diagnostic wax up. If we bring in the diagnostic wax up, all right, so now let's align that model So our wax up model, we're going to align using align to model. We're going to align using points, and we're going to align to our other yellow model, the pre-op. So we hit OK. So now our pre-op model is on the left, and our wax up model is on the right. And I can easily find points here that match because these are both clean models with no scatter. Hit OK. Now we've got our wax up in. Let's turn off the pre-op model and let's just look at just the wax up. Now I can take these cylinders that are on the implants and make them look like pilot drills. So my diameter, change it to 2. Go to this implant, diameter, change it to 2. Now if you look, you can see that I've got that premolar implant emerging perfectly. This one could be slid forward a little bit to get it in the center of there. And buccolingually, I might can improve that, but let's see what it looks like in the slices. So, can I make this any different now that I know where the wax up is? I can probably straighten that up a little bit, move it slightly lingual, and I kind of like that position right there. So that's a 4609. I could also get it a little closer to that premolar. To make things work even a little better. Now going back to the molar implant, looking at it. Yeah, I'm going to position it right about there. Okay, so now I know. Let me change the color on this model so you can see it a little more clearly. But now I've got my 2 implants right where I want them relative to the future crown on number 21 and the position of 19 and 20 that works with the occlusal scheme that we've got set up in Blue Sky, in ExoCAD. So we can take all of this information and I can now bring in, use this model right here, and I can create a surgical guide to place these 2 implants. If we go to the implant list, one of the first things you want to do is make sure you got the right surgical guide selected. The With the correct surgical guide selected, Blue Sky will now automatically figure the offsets and the guide hole diameters using the particular sleeves. Now, I'm using BioHorizon Complete Guided Kit, BioHorizon sleeves. You got to make sure you got this selected right. They have a whole variety of different kit choices here. I can use a BioHorizon Complete Guided Kit. Where is it? I could use this. This is the one that I'm using now. I can use the BioHorizon Complete Guided Kit and order my sleeves from Blue Sky. And this is the BSB sleeve. So since I have a whole stock of these sleeves from BioHorizon, I just select this one. But this will set up all the parameters for each implant. For your guide hole diameter, your height, your offset, all that becomes automatic. So you no longer have to calculate that for each implant in your plan. It used to be when we did this with, we'd have 8 implants in a plan. We'd have to calculate the offset for each one, and that was very difficult to do. So this is much more simple. We've got the right guide kit selected. We want to turn on our sleeves. These are the sleeves that they will determine the size of the holes that will fit the particular sleeve that you have selected. Okay. We've already got our implants properly aligned. I do want to go back now and check my sleeves to make sure that the bottom of this sleeve is not going to touch the bone, which would impede being able to seat the guide. As long as the bottom of the sleeve does not touch the tissue line, you can actually determine that this case could be done flapless if you had enough attached tissue. Now, I don't think in this case that I do. And so, but I can see that my sleeve is far separated from bone. I don't have any issues of having to reduce bone like you do in some cases. And matter of fact, we're pretty far away from even the tissue line in this particular case. However, with the sleeve being, with the tissue being very thin, I don't think I have enough attached tissue. We're going to have to flap anyway. So, no big deal. Just checking our sleeves to make sure, and I always do that for each implant, to make sure that I don't have any issues with sleeve interference as we're trying to seat this guide. So, that all looks good. My sleeves are turned on. I can flip over to the guide panel. And in the guide panel, I'm going to draw a curve. I've got the pre-op model selected. Which is the yellow model. And I'm going to go down to, in the surgical guide section, you really don't have to worry about these settings. The default settings work very well. Mandible is selected. And I can slide down here to where I'm going to draw the curve. So as I draw the curve, I can go ahead and rest on this tooth back here since it's still in place. It gives us a nice distal stop for our guide. So I'm going to hold the shift key and I'm just going to mark the periphery of the guide. Now I don't want to come way down on the buckle here so that my flap will get out from under this guide fairly simply, but I have to stay a little bit away from those sleeves or I'll create a weak spot. And I just usually click around the cervicals of each tooth and rotate around. For a guide like this, I would come sort of to the opposite canine. Now I'm going to go a little bit past because I like to create a flat surface that comes right across that canine right there, and I'll show you that in a minute. So if I click on the linguals here, now Blue Sky will block out the undercuts. You don't have to worry about the undercuts. That's all taken care of. And then I'm just going to cut real close to these sleeves in this particular location. And here again, I'm going to wrap around the distal just so I can cut that flat. And then you always want to click on the last spot just to close the circle. Here again, all of these dots are created by holding the Shift key and left clicking. So we have our guide outline done. We can go ahead and let Blue Sky generate this guide. And we'll find the right button, create surgical guide. And Blue Sky will do all the calculations. Now, like I said, Blue Sky blocks out all these for you. You don't have to worry about that. It creates the tolerances for this guide. So now the guide populates on the screen and we're kind of good to go. But here again, I want a flat surface on the distal of this canine where I can judge the seating better. And so I'm going to add a window here. And this window, I got to make it where wherever I position this window, it will cut the guide. So it'll just make that part of the guide will go away. So I want it to come sort of right across that cuspid. I want this flat surface. This is going to be my cut plane right here. But if I stopped it right there, it would leave this little flag of tissue here, of guide material here. So I'm going to drag this way down past where the guide is. I'll look at it from all angles. I'm going to go a little further past the guide there just so I get a good cut. Okay. And that should cut my guide nice and smooth right through the midline of that cuspid. So I'll have a nice viewing area there, and I'll show that to you in a second. I want to add another visualization window back here because I want to cut it smooth on this molar as well. Now as I look from the side, this is going to be my cut lane. So I want that to go kind of in the long axis of that molar, sort of midway, just to give me a good solid rest, but not have a good solid rest, but be able to visualize the seating at the back edge. And you'll see that in a minute. So I think that's going to be pretty good. And I would like a visualization window right here to cut a hole so that I can see the seating of the guide in this area, in the middle. Because if I've got a guide that seats well, now I can turn the visibility of this guide off, and I can see this better. I can see where I'm lining it up. And a lot of times, it's personal preference, but I'm going to create a cut line that's right on the top of those incisal edges. Here again, you'll see this in a minute. I'm going to drop it down a little further on there. Okay. So now I've got my cut planes. Let me move this one. I'm going to rotate this, and I want to get it in the middle of that cuspid. All right. So now I come over here to surgical guide, the guide panel, and I need to recheck on show curve, and now create another surgical guide, and this one will have windows in it. I could have placed these windows before I did the first surgical guide, but now you get to see both of them. So you see that now I can put a mirror back here and I can see that this fits intimately on that cuspid. It's a nice flat surface. I can also double check it against the surface of this molar that's back here. And then in the anterior, I can see the fit very clearly across those incisal edges and then at the mesial and distal of that window as well. So this works very well. I would say I'm going to now label this guide using my, I'm going to put the patient's initials on it. And I'm going to move this over to here. And I like to do an embossing, an engraving rather than an embossing. And so now I can make sure I got my guide with windows selected, and I can apply the text. Now over here, let me go back to my implant list. So number 20 is a 4809, and 19 is a 3809. So in my guide, okay. $46.09 doesn't always cooperate right away. $46.09, and this is going to use a 21 millimeter drill. I'll show you how to get that in a minute. And I size that so it'll fit, and I'm going to emboss that right there. And then my posterior implant, number 19, is a 3809. And I'm going to move that back here. And emboss it right there. Or engrave it right there. So now if I pick this guide up, if it's laying around in an office somewhere, and I pick it up, I can know the initials of the patient. I can know, not a bad idea to lock these implants when you're doing this. I can come over here and lock them so that that kind of thing won't happen. But a 4609 with a 21 millimeter drill and a 3809 with a 21 millimeter drill. Now, the way that I can go back to my surfaces, and that first guide we made, I'm just going to delete it because the guide with windows is the one that I want to actually export and 3D print. So if I go back over here to, let me turn the visibility of this guide off. Let me turn off the sleeves. And let me even change the color of this model for what I'm trying to do here. And I want to print, I want to copy this screenshot. If I click on screenshot, save screenshot, now it'll save that screenshot. Why do I want that? Because this is an image that I could reproduce at surgery. I could drill my pilot holes and I could stick some guiding pins in there, and I could look at this image and see, is my guide doing what I expected that it should do? You might also like to save something like this view right here, where you're looking right down that occlusal plane. So let me save that screenshot. So now I'm going to come down here and create a PDF, and the PDF, if I select OK, it's going to have all of the information on it. It's got the patient name, it's got the implant sites, the implant you're putting in, the diameters, the number of drills, and the drill depth. This is where I just happen to know that this protocol calls for a 21 millimeter drill. But if you didn't know that, you would generate this report, and then you'd know what drill links to emboss on your surgical guide. So I'll end up saving this and and printing it out and having this available, right at surgery. So at this point, we're ready to export the guide and go ahead and 3D print. Now you would come up here to the top menu on the File menu, and this is going to be off the screen right now, but you would drop down to Export Data, and this window comes up. You can turn off everything except the guide with windows, because you don't want to export all of these things. Everything that's checked, you just uncheck it. And if you export just the guide with windows, it will give you, it'll export the guide, you'll save it to your hard drive, then you can take and throw this guide on a printer and 3D print it accordingly. Okay, that pretty much does it for taking a case like this and starting in ExoCAD to figure out where you want the teeth to be, bringing it into Blue Sky, planning 2 implants, and in the process we kind of figured out that, quite frankly, if we did a couple of extra crowns for this patient, that we could fix their occlusion, and that is certainly going to be my course of action. This is where ExoCAD in combination with Blue Sky really excels in being able to do these cases and do them comprehensively and with the highest quality that you could possibly offer to the patient. And in the process, it generates more dentistry. You're not pushing things patients don't need. You're just doing good solid dentistry. And we figured out that really we would be better off if we did 2 additional crowns in this case. If the patient doesn't want to do it, they can sign off on the issues of not doing it. But I find that many times patients will go along with this if you show them all this and you explain the reasons why it would be good for them. And in her case, with her muscle pain and muscle discomfort, I firmly believe that getting her off of her back teeth, where she's not guiding on back teeth, is going to have a huge impact in her comfort level down the road. Getting her muscles to relax, getting her to not waking up with tired muscles, sore face muscles in the future, and furthermore, to keep her from breaking and wearing down her teeth over time. In addition to the fact that implants do not like lateral forces, so if we get to where she can guide on her front teeth and not have lateral forces on her back teeth, then the implants have a much better chance of survival down the road as well. So, hope you enjoyed it. We'll put this together and maybe see you again sometime. Thank you. If you would like some personal training into how to incorporate these digital processes into your daily workflows, feel free to contact me